Greetings, I am John Paulo Policarpo, Development Management Officer 3 of the Health Facility Development Bureau. I am pleased to present to you the overview of the Healthcare Waste Management Manual 4th edition. For the outline of this presentation, it will cover the introduction, overview of the Healthcare Waste Management Manual, and last is the Healthcare Waste Management Standard Self-Assessment Tools. For the organizational structure of the Department of Health, we are under the Health Facilities Infrastructure and Development Team, chaired by USEC Lilibet C. David, followed by the Health Facility Development Bureau, headed by Director Maria Teresa G. Vera. HFDB has an administrative unit and three functioning divisions, mainly the Policy Planning and Program Development Division, the Health Systems Development and Management Support Division, and the Research and Performance Management Division. As follows are the mandate of the Bureau. First, we develop plans, policies, programs, and strategies on health facility development planning, operation, and management. Second, the Bureau provides coordination, technical assistance, capacity building, consulting, and advisory services related to the health facility development planning, operation, and management. Lastly, advises the Secretary and Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. The main topic of this presentation is the DOH Healthcare Waste Management Manual, 4th edition. Note that the previous manual may still serve as a reference material for the parts that has no updates yet. A brief history of this manual. The first edition of the manual was entitled as Hospital Waste Management Manual. It was formulated and issued by the DOH through the Environmental Health Service in 1997. In 2004, the DOH Environmental and Occupational Health Office issued the second edition of the manual and renamed it to Healthcare Waste Management Manual, as it is today. It is designed to provide guidance and practical information regarding safe, efficient, and environment-friendly waste management options, not just for hospitals, but other health facilities in the country. The DOH National Center for Health Facility Development adopted a more participatory approach by collaborating with various stakeholders in reviewing, enhancing, and updating its policies and guidelines. Published in 2011, the Healthcare Waste Management Manual 3rd edition is more user-friendly and substantiated with the new trends and universally accepted technologies. The review and updating of the manual is essential after 5 years or so to align with current initiatives and strategies to provide responsive information to all the stakeholders. The preparation of the Healthcare Waste Management Manual 4th edition was made possible through the technical assistance of the World Health Organization. Also, it was funded through the Australian Government Department of Foreign Affairs and Trade. The 4th edition manual shall serve as the most comprehensive set of guidelines on the safe management of waste generated from healthcare activities in the country. It incorporates the requirements of all Philippine laws and regulations governing healthcare waste management and is designed for the use of individuals, public and private establishments, and other entities involved in segregation, collection, handling, storage, treatment, and disposal of waste generated from healthcare activities. The Healthcare Waste Management Manual is supported by these umbrella programs by the Bureau: the Integrated Hospital Operations and Management Program, or which is commonly known as IHOMP, and the Continuous Quality Improvement Program, or CQI. To begin, this is the overview of the Healthcare Waste Management Manual 4th edition. For the content of this manual, it has 4 major parts, and each part is subdivided into chapters. Part 1, general considerations and overview. For this part of the manual, it has 4 chapters. The introduction to the manual. Next would be the general definition, typical sources, known categories, and other current generation of healthcare waste in the Philippine context. For chapter 3, an expanded discussion on healthcare waste risks, impacts to human health and the environment. Lastly, an updated list and overview of the guiding principles, relevant international agreements, national policies, issuances, and guidelines in Chapter 4. Again, for the first chapter, this will cover the introduction of the new edition, which comprises of the following: background, purpose and intent, scope and limitations, contents of the manual, approach, key concepts, and lastly, the expected outcomes from the healthcare facilities. Chapter 2, this chapter will discuss the healthcare waste source, categorization, and characterization. This will thoroughly define the different categories and characteristics of various wastes. It is also presented in this chapter on where the healthcare waste is generated and other waste assessment approaches. The following are its topics to be covered. Um, General definition of healthcare waste, categorization of healthcare waste, generation of healthcare waste, and waste assessment approach. Risk associated with healthcare waste. Protection of the health of staff, patients, and the general public is the fundamental reason for implementing a system for healthcare waste management. This chapter is concerned with identifying the types of hazards associated with healthcare waste and who may be a risk from them by describing the public and environmental health impacts that need to be controlled. Under this chapter are the following: persons at risk, types of hazard and mode of transmission, additional considerations and emerging threats of healthcare waste to public and the environment, risk assessment approach to healthcare waste management. For Chapter 4, this will cover the legislative, regulatory, and policy aspects of the healthcare waste. This chapter presents the salient points of the guiding principles and the existing international agreements, national policies, and related issuances and guidelines that can provide directions to healthcare facilities in providing, developing, and implementing their respective healthcare waste management programs. The following are the subtopics in this chapter: the guiding principles, the international agreements or conventions, national policies and related issuances, and other relevant issuances and guidelines. For part 2, healthcare waste management system, for this part of the manual, this will discuss the main components of the management system of wastes. For chapter 5, waste management planning. In chapter 6, it will cover the concept of waste minimization, while principles of proper healthcare waste segregation, collection, storage, and transport in chapter 7. This will be followed by the options for healthcare waste treatment and disposal. And lastly, the guidelines on management of wastewater generated by healthcare facilities in chapter 9. For the first chapter in part 2, chapter 5, healthcare waste management planning. This defines the strategy for the implementation of improved waste management and the allocation of roles, responsibilities, and resources. A well thought out plan describes the actions to be implemented by authorities, healthcare personnel, and waste workers. For the sub-chapters in chapter 5, it will cover the organization and functions, healthcare waste management committee, and healthcare waste management plan. For Chapter 6, healthcare waste minimization, the healthcare waste generated within the healthcare facility follows an appropriate and well-identified stream from point of generation until their final disposal. That is composed of several steps that includes waste generation, segregation, collection, and transportation, that is on-site and off-site, and storage, treatment, and disposal. This chapter will cover the principles in healthcare waste minimization, benefits of waste minimization techniques, and lastly, for the administrative control measures. Chapter 7 describes the proper segregation of healthcare waste at the point of generation, collection, storage, and transport or treatment prior to its final disposal. Um, it says that segregation is the key to effective waste management, and the proper implementation of waste management can ensure all healthcare waste will be treated according to the hazards it produces. Under this are the following: the principles, healthcare waste segregation, collection and transport within the healthcare facility, on-site storage of healthcare waste, off-site collection, and off-site transport. For Chapter 8, it will illustrate the different technologies and methods in waste treatment and disposal. This will cover the following topics: selection of treatment methods, basic treatment processes, treatment technologies, on-site healthcare waste treatment facilities, healthcare waste disposal. For Chapter 9, managing wastewater generated by healthcare facilities. As stipulated in the Philippine Clean Water Act of 2004, all healthcare facilities must have its own wastewater treatment plant or must be connected to a municipal or common wastewater treatment facility or an equivalent system for small healthcare facilities. In some cases, the healthcare facility must provide a pre-treatment to the wastewater prior to discharge to the municipal sewer. For this chapter, it will cover the following: composition of healthcare facility wastewater, sources and characteristics of healthcare facility wastewater, collection of healthcare facility wastewater, and treatment of healthcare facilities of wastewater. For part 3, administrative controls and requirements. For this part, it will present the administrative requirements to implement the healthcare waste management for Chapter 10. The health and safety practices for Chapter 11, and the healthcare waste management during emergencies, as well as emerging issues and trends in waste management generated in healthcare facilities. That's for Chapter 12. Administrative requirements. This explains appropriate healthcare waste management practices depends largely on the administrative and organization, adequate legislative and financial support, as well as the active participation by the trained and informed staff. For the subtopics in this chapter, it will discuss the following: oversight and management at the national and local levels, administrative requirements at the facility level, budgetary requirements to implement the healthcare waste management program, and lastly, the options for financing. Health and safety practices. The purpose of this chapter is to explain the hazards and infections risks the healthcare workers may encounter, and to prevent and control them on this for exposure to them. Under this chapter are the following: principles, occupational health risks, exposure to prevention and control, hospital hygiene and infection control, occupational health and safety program, and lastly, education, communication, training, and awareness. For Chapter 12, Healthcare Waste Management in Emergencies, the purpose of this chapter is to provide contingency planning and emergency preparedness of healthcare facility to manage efficiently all types of emergency and to bring an order for recovery to and back to sustain the development. For the subchapter of this emergency management plan, contingency planning and emergency preparedness, and lastly, the emerging issues. For part 4, the glossary, annexes, and references. The final part of the manual includes the glossary, annexes, and references that provides an updated listing and definition of terms used in the manual. The annexed supplementary materials, example of that are the process flow, diagrams, requirements and guides, procedures, sample checklist and forms, drawings and illustrations. Also, it is included there are links to the online resources and references which are used to formulate and update the 4th edition manual. Healthcare Waste Management Standards, Self-Assessment Tool. For the Healthcare Waste Management Assessment Tool, it is divided into 6 sections, namely the general information of the corresponding health facility, healthcare waste management, healthcare waste treatment and disposal, waste management, wastewater management, and operations management, and lastly, the risks of current waste management system. For the healthcare waste management self-monitoring tool, this tool may serve and guide the healthcare facility regarding to its status in line with the healthcare waste management manual. With the tools presented, separate the department memorandum will be issued and will direct the healthcare facility to submit an accomplished assessment and monitoring tool, which will be used for our baseline data for healthcare waste management of healthcare facilities in the Philippines. As presented on your screen is the Department Circular number 2020-0191 of the Healthcare Waste Management Manual 4th edition. It has been circularized last April 2020 with this DC. Also, you may access and get a copy of this manual through the link provided. And you may refer to the other link presented for other Health Facility Development Bureau development manuals. For the other HFDB programs presented on your screen are the following: systems, programs, projects, and databases lodged under the Health Facility Development Bureau. For concerns and inquiries, please contact us at the following details. Maraming salamat po.